They randomized patients with stage 3 or 4 node-positive rectal cancers to preoperative radiotherapy and surgery, or surgery and postoperative. And I'll skip over that. They confirmed the hypothesis that it was much less toxic. Acute toxicity in the post-op radiation group, 40% versus 27% in the pre-op group. Long-term toxicity, this low anterior syndrome I mentioned, where you have terrible bowel function with incontinence, urgency, and bleeding, essentially doubled. So the German study group, this published in the journal several years ago, confirmed the toxicity and compliance. As I said, if you put somebody through a rectal cancer operation, a significant fraction of those patients will not have the wherewithal to go through radiation. And you can see that full dose radiation was only completed in 54% of the patients who were randomized to postoperative treatment. There's no benefit on survival, however. The survival curves were virtually identical. Local failure rates, however, were essentially doubled in the post-op radiation group, and highly statistically significant. This study was updated just last month in the Journal of Clinical Oncology, confirming there's still not a survival advantage, which surprised most of us, and the local failure difference is starting to change a little bit. So there's not a huge oncology benefit of giving preoperative radiotherapy. I think most of us feel there is, but there probably isn't. But there's a huge difference in function. I can't tell you how devastating it is to get a path report after not doing radiation, showing positive nodes, having to do postoperative radiation. The patients do not do well long term. Another advantage of preoperative radiation came out of the German trial, and they